Let's talk about how to raise your mood. This is primarily for men, but there's a great study, I put the link down below, called Efficiency of Fasting and Calorie Restriction on Mood and Depression Among Aging Men. So there was 32 men in this study, an average age of 59, and they did this for 3 months. They did a combination of low calorie and also fasting, and the results were remarkable. There was significant improvement in less tension, less anger, less confusion. That's wild. Increased vigor and increased daytime concentration, not to mention other benefits like weight loss. So there's this condition called PEDS, partial endocrine deficiency syndrome. It's really just a syndrome that occurs in men as they age, where the endocrine system kind of falls apart and the hormones get lower and lower and lower. Primarily, we have 2 hormones involved. We have testosterone and cortisol. So we have this spike in cortisol, the stress hormone, with a drop in testosterone. And by the way, when you increase cortisol, you do drop testosterone. So when you have this situation right here, which starts to happen at age 50 and it gets worse with time, a lot of times men will do testosterone replacement therapy, and what they might not realize is that even though it might help them in the short term, it will basically stop the production of this hormone in the pituitary called luteinizing hormone, and then that will cause atrophy of the gonads. Because when you're taking hormone, your body's own production doesn't have to work, and you basically shut down your own production of testosterone. So it comes with a package. And I don't think it's the best solution. There are other things that you can do that are very, very powerful. Number 1, fasting. If you're new to this channel and you haven't tried fasting, and you're a man over the age of 50, and you have any of the symptoms with lower testosterone or high cortisol, whether it's mood changes, cognitive changes, loss of muscle mass, lack of sex drive, ED, other issues, then fasting can greatly help you. And I'll put a link down below of how to do this correctly. Zinc is another very important trace mineral that can help enhance testosterone and lower cortisol at the exact same time. And number 3, L-arginine. L-arginine is a pretty inexpensive, non-essential amino acid that has the ability to increase growth hormone, increase testosterone, and it also increases something called nitric oxide, which can help erectile dysfunction and lower blood pressure and help blood flow to the brain. So this one actually is really important in men as they get older. And then exercise in general. And then, of course, I'm just assuming you know about healthy keto. You would want to add that as well. Then you'd have a really good combination to pull yourself out of any lower mood situation that you have and help to reverse this right here. If you want these benefits right here, simply do these things right here. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call. But I put the number down below so you can call and get some help.